Question 1. In the context of radiation safety, which of the following principles ensures the minimization of unnecessary radiation exposure to both patients and healthcare workers? A. The principle of inverse square law. B. The ALARA principle as low as reasonably achievable. C. The concept of beam hardening. D. The principle of attenuation. Answer. Correct answer. B. The ALARA principle as low as reasonably achievable. Explanation. The ALARA as low as reasonably achievable principle is a foundational concept in radiation safety. It emphasizes minimizing radiation exposure by optimizing imaging protocols, using appropriate shielding, and ensuring that imaging is only performed when necessary for diagnosis or treatment. This principle applies to both patients and healthcare work. Reduce unnecessary risks. The inverse square law A relates to the intensity of radiation and its distance from the source, while beam hardening C and attenuation D refer to how X-rays interact with matter, not to safety principles. ALARA aims to balance the necessity of radiological procedures with the risks involved, ensuring safety without compromising diagnostic value. Question 2. Given the circumstances of a 45-year-old female with a suspected lung malignancy, what imaging modality would be most appropriate for staging and treatment planning, especially considering the tumor's location and the need for high-resolution anatomical imaging? A. Magnetic resonance imaging (MRI). B. Ultrasound. C. Computed tomography (CT). D. Fluoroscopy. Answer. Correct answer. C. Computed tomography (CT). Explanation. For staging and treatment planning of a suspected lung malignancy, CT imaging is the most appropriate modality due to its high-resolution imaging of soft tissues and ability to provide detailed anatomical information. CT is particularly useful in assessing lung tumors, their extent and involvement of adjacent structures, which is essential for staging and surgical planning. MRI is not typically used as the first choice for lung imaging. Ultrasound B does not provide sufficient detail for this purpose, and fluoroscopy D is more appropriate for real-time procedural guidance rather than tumor staging. Question 3. When analyzing the interaction of X-rays with matter, which of the following statements best describes the photoelectric effect, a key process in diagnostic radiology? A. It involves the absorption of an X-ray photon by an outer electron, causing it to be ejected from its atom. B. It involves the transfer of energy from an X-ray photon to an inner electron, ejecting it and absorbing the photon's energy. C. It results in the scattering of the photon and no energy transfer to the atom. D. It leads to the creation of secondary radiation that is scattered throughout the body. Answer. Correct answer. B. It involves the transfer of energy from an X-ray photon to an inner electron, ejecting it and absorbing the photon's energy. Explanation. The photoelectric effect occurs when an X-ray photon is completely absorbed by an inner electron of an atom, typically in the K-shell, ejecting the electron from its orbit and resulting in the complete absorption of the photon's energy. This effect plays a crucial role in the contrast seen radiographs and is significant in imaging structures with high atomic numbers, such as bone. The other options, A, C, and D, describe different phenomena, such as Compton scattering or secondary radiation, which are not specific to the photoelectric effect. Question 4. In terms of contrast media, a patient presents with a history of asthma. Which of the following contrast agents would be the most appropriate choice for their imaging procedure? A. Iodinated non-ionic contrast media. B. Iodinated ionic contrast media. C. Barium sulfate. D. Gadolinium-based contrast agents. DB. Answer. Correct answer. A. Iodinated non-ionic contrast media. Explanation. Iodinated non-ionic contrast agents are generally considered safer for patients with asthma as they are associated with a lower incidence of allergic reactions compared to ionic contrast media. B. These non-ionic agents are less likely to cause bronchospasm or other adverse effects, making them the preferred choice in asthmatic patients. Barium sulfate C is primarily for gastrointestinal imaging and would not be appropriate for this patient. Gadolinium-based agents D are typically used for MRI imaging, not X-ray or CT procedures. Question 5. During an abdominal CT scan, a radiologist notices that the image quality is compromised due to streak artifacts. Which of the following factors is most likely to contribute to the development of these artifacts? A. Incorrect window settings. B. Motion from the patient. C. High radiation dose. D. Beam hardening from dense structures like bones. Answer. Correct answer. D. Beam hardening from dense structures like bones. Explanation. Beam hardening occurs when X-ray photons pass through dense materials, such as bones, and lose lower energy photons, resulting in streak artifacts on the CT images. This phenomenon distorts the image and can interfere with the accurate diagnosis of soft tissue structures. While motion B and incorrect window settings A can affect image quality, beam hardening is the most likely cause in this scenario. A higher radiation dose C generally improves image quality but does not directly cause artifacts. Question 6. In the context of nuclear medicine, which of the following radiotracers is primarily used in the diagnosis of bone metastases? A. Fluorodeoxyglucose FDG. B. Technetium-99 meters MDP methylene diphosphonate. C. Iodine-131. D. Gallium-68. Answer. Correct answer. B. Technetium-99 meters MDP methylene diphosphonate. Explanation. Technetium-99 meters MDP, a commonly used radiotracer for bone scans in nuclear medicine, especially for detecting bone metastases. It binds to hydroxyapatite in bone, making it highly sensitive for identifying areas of bone involvement in metastases. Fluorodeoxyglucose (FDGA) is typically used for scans to assess metabolic activity in tumors, but is not specific to bone metastases. Iodine-131C is used for thyroid imaging, and Gallium-68D is more commonly used in neuroendocrine tumor imaging. Question 7. Mr. Williams, a 60-year-old male, presents with a suspicious mass in the abdominal region. The physician suspects a liver tumor. What imaging modality should be used to assess the nature and extent of this mass? A. MRI of the abdomen. B. Abdominal X-ray. C. CT scan of the abdomen with contrast. D. Ultrasound of the abdomen. Answer. Correct answer. C. CT scan of the abdomen with contrast. Explanation. A-KNI with contrast is the most appropriate imaging modality for evaluating liver masses, as it provides high-resolution images of both the liver and surrounding structures, helping to assess the size, location, and vascular involvement of the tumor. MRI may also be useful, particularly for characterizing the tumor in more detail, but CT is typically the first choice for abdominal imaging. X-ray B does not provide sufficient detail for soft tissue structures like the liver, and ultrasound D is more commonly used for initial screening but is less accurate for precise staging. Question 8. From the perspective of radiology, which of the following is a potential risk associated with the use of gadolinium-based contrast agents, GBA, MRI imaging? A. Contrast-induced nephropathy. B. Thyroid dysfunction. C. Nephrogenic systemic fibrosis, NSF. D. Risk of tumor progression. Answer. Correct answer. C. Nephrogenic systemic fibrosis, NSF. Explanation. Nephrogenic systemic fibrosis, NSF, a rare but serious complication associated with the use of gadolinium-based contrast agents, GBA, in patients with severe renal impairment. This condition leads to fibrosis of the skin and other tissues and can cause significant morbidity, although contrast-induced nephropathy A is a risk with iodinated contrast agent. It is not a concern with gadolinium agents. Thyroid dysfunction B and tumor progression D are not directly associated with the use GB. Question 9. Considering the advanced imaging capabilities in pediatric radiology, which imaging modality is preferred when evaluating a young child for a suspected foreign body aspiration? A. Chest X-ray. B. CT scan of the chest. C. MRI of the chest. D. Ultrasound of the chest. Answer. Correct answer. A. Chest X-ray. Explanation. Chest X-ray is the preferred initial imaging modality for evaluating foreign body aspiration, especially in pediatric patients. It can reveal the presence of radiopaque objects and signs of airway obstruction, which is crucial in this setting. While CT-B provides more detailed images, it is not typically used as the first-line imaging tool in children due to concerns about radiation exposure. MRI-C is not commonly used for this type of evaluation. An ultrasound D. Is not effective for detecting foreign bodies in the chest. Question 10. In the context of interventional radiology, which of the following procedures is most commonly used to treat a patient with a hepatic hemangioma that is causing symptoms such as pain and bleeding? A. Percutaneous biopsy. B. Angioplasty. C. Transcatheter arterial embolization. D. Intravenous laser therapy. Answer. Correct answer. C. Transcatheter arterial embolization. T. Explanation. Transcatheter arterial embolization (T) is a minimally invasive procedure commonly used in interventional radiology to treat symptomatic hepatic hemangiomas by selectively blocking the blood supply to the tumor, thus alleviating pain and preventing bleeding. Percutaneous biopsy A is used for diagnostic purposes but is not a treatment. Angioplasty B is typically used for vascular stenosis or blockages, and intravenous laser therapy. D is used for varicose veins, not for liver tumors. Question 11. When evaluating the potential for radiation-induced skin reactions in a patient undergoing fluoroscopy, what is the most significant factor influencing the likelihood of such reactions? A. Duration of the fluoroscopic procedure. B. Patient age and overall health. C. Amount of contrast media used. D. Radiation dose rate during the procedure. Answer. Correct answer. D. Radiation dose rate during the procedure. Explanation. The risk of radiation-induced skin reactions in fluoroscopy is significantly influenced by the radiation dose rate, as high doses over a short period increase the risk of skin damage. ELARA, as low as reasonably achievable, principle recommends minimizing exposure both in terms of the duration of the procedure and the intensity of the radiation dose. The skin's threat for damage typically correlates with dose rate and the total radiation dose rather than solely with patient factors such as age or the amount of contrast used. The American College of Radiology, ACA, and Radiological Society of North America, USNA, guidelines stress controlling fluoroscopic beam intensity and utilizing dose reduction technologies to prevent skin burns or erythema. Question 12. Considering the principles of dose optimization in computed tomography (CT), which of the following strategies is most likely to result in a reduction in patient radiation dose while maintaining diagnostic quality? A. Increasing the scan duration to reduce noise. B. Using iterative reconstruction algorithms. C. Increasing the tube current during the scan. D. Decreasing the slice thickness for better resolution. Answer. Correct answer. B. Using iterative reconstruction algorithms. Explanation. Iterative reconstruction algorithms are a key advancement in CT imaging that allow for improved image quality at reduced radiation doses. These algorithms decrease noise and artifacts, providing high-quality images at low doses compared to conventional methods. The use of increased tube current, option C, or prolonged scan duration, option A, would increase patient's radiation dose without corresponding benefit in diagnostic quality. Decreasing slice thickness, option D, can improve resolution but also increases radiation dose, so this must be balanced with the need for image quality and diagnostic accuracy. Question 13. In the context of digital radiography, Doctor, how does the use of a wider dynamic range in the imaging system improve the diagnostic value of the radiographic images? A. It allows for better visual representation of subtle differences in tissue densities. B. It reduces the need for post-processing adjustments. C. It results in shorter exposure times for patients. D. It minimizes the risk of overexposure in high-density areas. Answer. Correct answer A. It allows for better visual representation of subtle differences in tissue densities. Explanation. A wider dynamic range in digital radiography enables the system to capture a broader range of tissue densities from bone to soft tissues with greater accuracy. This allows for improved visualization of subtle differences between tissues, enhancing the diagnostic value of the images. While options B and C can be considered in certain contexts, they are not direct consequences of a wide dynamic range. Option D refers more to automatic exposure control mechanisms rather than dynamic range itself. Question 14. When a patient undergoes MRI imaging with gadolinium-based contrast agents, which of the following is the most appropriate action to ensure patient safety in those with a history of renal impairment? A. Reduce the dose of gadolinium used. B. Use a non-contrast MRI technique instead. C. Perform a thorough renal function test before administering contrast. D. Administer additional hydration before the MRI to improve contrast efficacy. Answer. Correct answer. C. Perform a thorough renal function test before administering contrast. Explanation. Patients with renal impairment are at a higher risk for nephrogenic systemic fibrosis (NSF) when exposed to gadolinium-based contrast agents (GBCAS). Therefore, it is essential to assess renal function before administering contrast to minimize the risk of NSF. A reduced dose or non-contrast MRI may be considered depending clinical indication, but a thorough renal function test, such as serum creatinine or glomerular filtration rate, is the standard practice to ensure safety. The ACA recommends assessing renal function in at-risk populations before contrast administration. Question 15. In the field of interventional radiology, what is the primary advantage of using a radial artery approach over the femoral artery approach for coronary angiography? A. Reduced risk of bleeding and hematoma formation. B. Improved image resolution during the procedure. C. Faster procedure time due to easier access. D. Greater patient comfort due to reduced radiation exposure. Answer. Correct answer A. Reduced risk of bleeding and hematoma formation. Explanation. The radial artery approach for coronary angiography is preferred over the femoral artery approach in many cases due to a significantly low risk of bleeding and hematoma formation. This method is associated with less patient discomfort and a quicker recovery time. Although it may not improve image resolution, option B, or procedure time, option C, it is safer and less invasive option, particularly for patients with a higher bleeding risk. Reducing radiation exposure, option D, is a concern in both approaches, but is not directly affected by the choice of access site. Question 16. Which of the following factors is most likely to affect the choice of imaging modality for a patient presenting with suspected ischemic stroke? A. The patient's age and gender. B. The time elapsed since symptom onset. C. The presence of chronic comorbidities. D. The patient's previous imaging history. Answer. Correct answer. B. The time elapsed since symptom onset. Explanation. In ischemic stroke, the timing of symptom onset is critical for determining the most appropriate imaging modality. Non-contrast CT computed tomography is typically used initially to rule out hemorrhagic stroke, while MRI is preferred for detecting ischemic changes in the early hours. Diffusion-weighted imaging (DWI) MRI can detect ischemic injury as early as within the first few minutes of symptom onset. The patient's age, gender, and comorbidities can influence management decisions but are not primary factors for modality choice. Question 17. Which of the following is the most important principle when interpreting abdominal CT scans in the diagnosis of acute appendicitis? A. Identification of extraluminal gas. B. Visualization of the appendix diameter exceeding 6 mm. C. Absence of contrast enhancement in the appendix. D. Detection of bowel wall thickening. Answer. Correct answer. B. Visualization of the appendix diameter exceeding 6 mm. Explanation. The most important criterion for diagnosing acute appendicitis on abdominal CT is the visualization of an enlarged appendix, typically exceeding 6 mm in diameter, while extraluminal gas, option A, and bowel wall thickening, option D, may suggest complications. They are not primary diagnostic features for appendicitis. Absence of contrast enhancement, option C, is not an effective diagnostic criterion for acute appendicitis on CT. The ACA guidelines recommend using CT for appendicitis when clinical signs and symptoms are inconclusive, and the 6 mm threshold for the appendix diameter is a well-established marker. Question 18. In pediatric radiology, which of the following radiologic findings would most likely indicate a congenital diaphragmatic hernia? A. A solid mass in the abdomen without bowel gas. B. Displaced heart and mediastinal shift on a chest radiograph. C. Multiple air fluid levels in the small bowel on an abdominal X-ray. D. Abnormal calcifications within the abdominal mass. Answer. Correct answer B. Displaced heart and mediastinal shift on a chest radiograph. Explanation. A congenital diaphragmatic hernia CH typically results in a displaced heart and a mediastinal shift visible on a chest radiograph. This occurs due to the herniation of abdominal contents such as loops of bowel or liver into the thoracic cavity through a defect in the diaphragm, a solid abdominal mass without bowel gas option A. Less specific for CH and air fluid levels option C are more suggestive of an intestinal obstruction. Normal calcifications option D could indicate a different pathology such as a tumor or infection. Question 19. Which of the following strategies is most effective for reducing the radiation dose to pediatric patients undergoing CT imaging? A. Use of higher milliampere-seconds mass to improve image quality. B. Routine use of contrast agents for all pediatric CT studies. C. Reduction of scan length by focusing on the region of interest. D. Increased scan duration to reduce noise. Answer. Correct answer. C. Reduction of scan length by focusing on the region of interest. Explanation. Reducing the scan length to focus only on the region of interest is one of the most effective methods for reducing radiation dose in pediatric CT imaging. This approach limits unnecessary radiation exposure to surrounding tissues. Increasing mass option A or scan duration option D would result in higher radiation doses, which should be avoided, especially in pediatric patients. Routine use of contrast option B should be based on clinical indications and does not contribute to radiation dose reduction. Question 20. Any assessment of head trauma on CT, which of the following findings would be considered most concerning for a life-threatening intracranial hemorrhage, A. Hyperdense area in the brain parenchyma without midline shift, B. Presence of a thin subdural hematoma without associated mass effect, C. Hyperdense mass with evidence of midline shift and herniation, D. Isolated bone fractures with no evidence of parenchymal injury. Answer. Correct answer. C. Hyperdense mass with evidence of midline shift and herniation. Explanation. A hyperdense mass with midline shift and herniation is the most concerning sign on CT for a life-threatening intracranial hemorrhage, such as an epidural hematoma or a large subdural hematoma. This finding indicates significant intracranial pressure and can lead to herniation, which is a medical emergency. While a thin subdural hematoma with mass effect option B may be observed, it is less critical compared to a mass with midline shift. Isolated bone fractures without brain parenchymal injury option D generally do not pose an immediate risk for life-threatening conditions. Question 21. When performing an EKIN for the evaluation of pulmonary embolism, P, which of the following features is most suggestive of a large central embolus? A. Presence of a Westermarck sign indicating vascular collapse. B. Filling defect in the pulmonary artery with distal vessel dilation. C. Multiple small peripheral emboli scattered throughout the lung fields. D. Ground glass opacities in the lower lobes. Answer. Correct answer. B. Filling defect in the pulmonary artery with distal vessel dilation. Explanation. A filling defect in the pulmonary artery with distal vessel dilation is the most suggestive feature of a large central pulmonary embolus, as it indicates a blockage in the main pulmonary artery. The Westermarck sign, option A, may also be seen but is more characteristic of a secondary finding, not definitive, for large emboli. Small peripheral emboli, option C, are more typical of peripheral or subsegmental emboli, and ground glass opacities, option D, can be seen in many other pulmonary conditions but are not specific to P. Question 22. Which of the following findings on a chest X-ray is most indicative of a tension pneumothorax? A. Increased lung density on the affected side. B. Flattening of the diaphragm with a visible pleural line. C. Shift of the mediastinum away from the affected side. D. Air bronchogram sign in the affected lung field. Answer. Correct answer. C. Shift of the mediastinum away from the affected side. Explanation. A tension pneumothorax results in the accumulation of air under pressure, which can cause a shift of the mediastinum and other structures away from the affected side. This is a life-threatening condition requiring immediate intervention. Increased lung density, option A, is not typically associated with a pneumothorax but may occur in other pulmonary pathologies. Flattening diaphragm, option B, and air bronchograms, option D, are more suggestive of different conditions like atelectasis or consolidation. Question 23. Which of the following is the most appropriate next step when an incidental adrenal mass is found on CTE? A patient without symptoms. A. Immediate surgery to remove the mass. B. Repeat imaging in 6 months to assess for growth. C. Obtain a serum cortisol level to assess for hormonal activity. D. Perform an MRI to better characterize the mass. Answer. Correct answer B. Repeat imaging in 6 months to assess for growth. Explanation. When an incidental adrenal mass is discovered on CT, the most appropriate next step is to monitor the mass with repeat imaging after 6 months to assess for any growth or changes. Many adrenal masses are benign and do not require immediate intervention. Hormonal evaluation, option C, may be performed if there is concern for functional adenomas, but root testing is not required for all incidentalomas. Surgery, option A, is typically only indicated if the mass is suspicious for malignancy or causing symptoms. Question 24. In pediatric imaging, which of the following conditions is most likely to present with a coiled spring appearance on a contrast enema? A. Intussusception. B. Volvulus. C. Hirschsprung's disease. D. Meconium ileus. Answer. Correct answer A. Intussusception. Explanation. Intussusception is characterized by the telescoping of one part of the bowel into another, often resulting in the coiled spring appearance on a contrast enema. This radiographic finding occurs because the contrast medium outlines the involved bowel segments. Volvulus, option B, typically shows a twisted bowel loop. Hirschsprung's disease, option C, involves a lack of ganglion cells in the distal colon and Meconium ileus, option D, shows a characteristic appearance of bowel obstruction in neonates, but none of these show the coiled spring appearance. Question 25. In the evaluation of aortic dissection on CT, which of the following findings is most indicative of an acute type? A dissection. A. Presence of an intimal flap with false lumen in the ascending aorta. B. Disruption of the aortic arch with intramural hematoma. C. A tear involving the descending aorta and no involvement of the ascending aorta. D. Calcification of the aortic wall with no evidence of a flap. Answer. Correct answer A. Presence of an intimal flap with false lumen in the ascending aorta. Explanation. Type. Aortic dissections involve the ascending aorta, and the classic CT finding is the presence of an intimal flap and false lumen in the ascending aorta. This is a life-threatening condition requiring immediate surgical intervention. Disruption of the aortic arch, option B, and involvement of the descending aorta, option C, are more characteristic of B. Dissections. Aortic calcifications, option D, are more typical of chronic atherosclerosis rather than acute dissection. Question 26. In the context of MRI of the brain, which of the following features is most characteristic of a demyelinating lesion and multiple sclerosis MS? A. Hyperintensity on twated images, especially in paraventricular regions. B. Hypointensity on twated images in the cortex. C. Contrast enhancement in the deep gray matter. D. Diffuse cortical atrophy with sulcal enlargement. Answer. Correct answer A. Hyperintensity on twated images, especially in paraventricular regions. Explanation. Multiple sclerosis MS is characterized by areas of demyelination that appear as hyperintense lesions on twate MRI, especially in the paraventricular white matter. These lesions are commonly seen in a pattern called Dawson's fingers. A hypointensity on twated images, option B, is typical of chronic lesions but not specific MS. Contrast enhancement, option C, can be seen in active MS lesions but is not a defining feature. Diffuse cortical atrophy, option D, is more suggestive of neurodegenerative diseases like Alzheimer's. Question 27. Which of the following is the most likely finding in A. Of a patient with acute pancreatitis? A. A hypodense mass in the pancreas with calcifications. B. Parapancreatic fat stranding and enlargement of the pancreas. C. A focal solid lesion with enhancing borders within the pancreas. D. A cystic lesion with a thick wall and solid components in the pancreas. Answer. Correct answer B. Parapancreatic fat stranding and enlargement of the pancreas. Explanation. Acute pancreatitis typically presents with parapancreatic fat stranding and enlargement of the pancreas on CT. This is a sign of inflammation. A hyperdense mass with calcifications, option A, suggests chronic pancreatitis or pancreatic cancer. A focal solid lesion, option C, could be a tumor, and a cystic lesion, option D, might suggest a pancreatic cyst or pseudocyst, but these are not typical findings in acute pancreatitis. Question 20. Which of the following is the most important factor to consider when determining the appropriateness of using contrast in A. For a patient with a known history of renal impairment, A. The patient's age, B. Serum creatinine level or estimated glomerular filtration rate ECFA, C. The presence of underlying cardiovascular disease, D. The type of contrast agent being used. Answer. Correct answer. B. Serum creatinine level or estimated glomerular filtration rate (ECFA). Explanation: for patients with renal impairment, the serum creatinine level or estimated glomerular filtration rate (ECFA) is the most critical factor in determining the risk of contrast-induced nephropathy (SIN). Patients with significantly impaired renal function may not clear contrast agents effectively, putting them at risk for further kidney damage. Age, option A, and cardiovascular disease, option C, may contribute to overall risk but are secondary considerations. The type of contrast agent, option D, can influence risk, but renal function remains the primary concern. Question 29. In the context of MRI imaging for spinal cord pathology, which of the following features is most suggestive of a primary spinal cord tumor rather than metastatic disease? A. Extradural lesion compressing the spinal cord with surrounding edema. B. Homogeneously enhancing lesion located centrally in the spinal cord. C. Irregular mass with mixed enhancement located in the vertebral body. D. Multiple lesions scattered throughout the spinal cord. Answer. Correct answer. B. Homogeneously enhancing lesion located centrally in the spinal cord. Explanation: primary spinal cord tumors, such as ependymomas or astrocytomas, typically appear as centrally located lesions within the spinal cord with homogeneous enhancement and MRI after contrast administration. Extradural lesions, option A, and vertebral body involvement, option C, are more suggestive of metastatic disease. Multiple lesions scattered throughout the spinal cord, option D, are more typical of metastatic cancer, particularly lymphoma or hematogenous metastases. Question 30. In the evaluation of a suspected hip fracture in an elderly patient, which of the following imaging modalities is considered the most accurate for detecting occult fractures? A. Plain radiographs X-ray. B. Computed tomography CT. C. Magnetic resonance imaging MRI. D. Bone scintigraphy. Answer. Correct answer. C. Magnetic resonance imaging MRI. Explanation: MRI is the most sensitive modality for detecting occult fractures, especially in the hip, as it can identify subtle bone, marrow changes, and soft tissue injuries not visible on plain radiographs X-ray. While CT, option B, can be helpful for complex fractures, MRI provides superior soft tissue and bone marrow detail. Bone scintigraphy, option D, can fractures but is less specific and typically used in cases of suspected stress fractures or when MRI is unavailable.